So what do we have in clinical signs with the brachy's? Well, the respiratory signs you all know about, but we have different gradings. I did my residency at the time this study was done. This is the resident that was before me in France. So I was trained in France, as you can hear. I'm not English. But we had tons of brachy's. And this is where my interest in the topic started, because I did most of the papers I did as a resident were on brachycephalics, because the trend of having French bulldogs and English bulldogs in France just started at that time. And we became the one center where we were doing them all. So we were doing hundreds a year. And so we started studying what we could do, because that was really not a great time to be a brachy, because we didn't know as much as we know now, and we didn't treat them as well as we do now. But we established this scheme where basically, very simple, we just wanted to be able to monitor how well we were treating them, and to do that you need to score them beforehand. And you can use this score, it's pretty easy to use. Basically, you'll see that the grade 1 is the yellow sign, so any snoring, but you should not have marked respiratory efforts or exercise intolerance or syncope if you're a grade 1. So basically, you're just having snoring and abnormal noises, but not seemingly very bothered by the breathing. Then at the other end of the spectrum, if you have had at least one episode of collapse, you're automatically a grade 3. And if you start asking, you'll see it's not uncommon to have these dogs collapse on exercise. So they will tell you, oh yeah, collapses. And owners are very often, we'll discuss that, but this is one of the struggles we have as vets, is that owners seem to be completely laid back about this, not realize, because they hear it's completely fine. They will tell you, oh yeah, he's collapsing every now and then. Okay. And they're not even coming for that. They're coming for something else, because he's scratching or whatever. And if you ask, you'll find out that actually the dog's not very well. So grading these signs, and you all know the respiratory signs, it's low snoring, you can have a bit of reverse sneezing. One of the signs that's not reported, but we observe regularly, is these dogs are unable to smell anything. And very often, on the day of surgery, and I've observed that very often, they start smelling like crazy. As you open their nose, the day of surgery, they probably have lots of blood in there still. They're probably not great, but they're sniffing, because it's probably the first time ever they actually have a sense of smell that's there. There's lots of things we don't think about, but these dogs really struggle on a number of levels. But there's also the other thing that people are starting to focus even more now on, is the digestive signs. So whenever you see a brachycephalics, whether it is for respiratory disease or not, think of asking how severe they are from a digestive point of view. And having abdominalism or regurgitation or vomiting is also very, very common. Same remark with the owners, that seem pretty low key on that. Once I asked them, a brachy, does he regurgitate? Oh yeah, okay, how often? And it was 7 to 10 times a day. And they were not even consulting for that. It was like, I thought it was normal. You thought it was normal 7 to 10 times a day, that they, yeah, right, breeder told me it was all right. Okay, well, fine then. But, and this is very, very prevalent. These digestive disease, the more we look at it, the more we find that they're almost all affected. So this was the first study, big study on brachy's we did then in France. And we had a protocol where we would do an endoscopy, a GI endoscopy, on all dogs that presented for breathing problems. All the brachy's that would present for breathing problems. And we found an incidence, nearly all dogs but one, we found digestive lesions. You can see reflux and esophagitis. That's super common. You see, you know what this is when you have an esophagus that's all tortuous like this? So it's just the esophagus, instead of being in a straight line, is completely circumvallated. And when we discuss what the brachycephalic syndrome is, you'll see it makes complete sense to have that, but that doesn't help swallowing and have no problems with the esophagus. These are jet lesions of gastroesophageal reflux. The gastroesophageal reflux we'll understand also very easily once we we summarize what this disease is. And this is hiatal hernia. And I'm not talking about the pyloric obstruction that you have in some dogs that can also make everything worse.